family's making this decision. Here's what happens. If you were to ask the family for this incapacitated patient, what do you want to do now? You're going to get all kind of answers. But if you were to ask the question, what did Joe, the patient, want? You should get only one answer, if they know. So sometimes the phrasing of the question gets the answer. So if you open it, hey, okay, kids, got 5 kids, what do you kids want us to do now? Oh boy. Because it really should go back, what did the patient want? That's the whole issue. Patient rights, as opposed to medical capabilities, what did the patient want? I heard a story about a husband and wife. The husband was on the sofa watching TV all night, drinking beer, and said to me, honey, if I'm ever existing only on a machine, only alive by a bottle of fluids, and pull the plug. So the wife got up, unplugged the TV, and poured his beer down the sink. That's advanced directives. Honey, do this for me. Witnesses. Who are the witnesses? Who is going to sign? The witnesses are verifying the signature, and actually, your law was quite different than any other state I've ever heard. It said, in yours, the witness does not even have to be there. But it says that the witness is not verifying that they signed. The witness does not have to see that the patient signed, but the patient has to see that the witness signed. I'm going, okay. It was just strange. I haven't heard one worded that way before. So the witness is normally in other states, the witness is saying, I saw them sign. So I'm witnessing the signature. Yours says it in a different way. The patient understands what they're signing. Normally they go. Now as a nurse, go down to that one. The nurse has a little bit harder job in this. If a nurse is sitting by the bed and helping the witness process, they can't be the witness because they're a hospital employee. But if they were standing there and they knew the patient were anoxic or just came out of surgery or under some kind of anesthesia, some kind of medication that they would not have full capacity, they should say, whoa. But normally if you're in an attorney's office, you're not talking about that issue. Normally if you're just at some kind of a health fair and you've got people come in doing their living wills, you aren't talking about that. But a nurse has a little bit different capacity. You as a chaplain may not know if the patient's anoxic or on medication or just came out of surgery. But it may be some questions to ask. Is this patient alert enough at this time? Is this a good time? They go, no. No. Okay, we'll wait a few hours tomorrow or something like that to get that done. Again, going back to the nurse to get information. Now a DNR, a do not resuscitate order, is different than a living will. A do not resuscitate order is during cardiopulmonary arrest, we're saying that they do not want that. They do not want that means. It does not mean do not treat me. It does not mean I don't want to go to the hospital. They may say, I want to go to the emergency room, I want to go to the hospital, I want to go to the doctor's clinic, treat me, take care of me, but if my heart stops, my lungs stop, let me go. But if I'm here in the hospital and my heart starts fluttering, blood pressure goes crazy, call the nurse and do something about it. But if you walk in the room and I'm dead or I'm blue or I'm gone, let me go. So I hear some nurses sometimes going, why are we taking that DNR to surgery for? Because she wants surgery. And then also go, and it's not about you. It's about what she wants. She doesn't want to be resuscitated, but she wants to go to surgery or wants to do this test or wants to do this kind of treatment. Now what they're kind of classifying is, well then that must be a hospice patient. No, I'll talk about different between a do not resuscitate patient who is a hospice patient and a do not resuscitate patient who wants treatment. Full code is a term here in the hospital you might hear as a chaplain coming in. They may tell you this patient's full code. What is that? That means they want everything. All the resuscitation treatment, the CPR, they need the paddles, if they need the cardiac drugs to do resuscitation, they need intubation, whatever they need, they're full code. Every patient that doesn't have a living will documented is full code. Every patient that does have an advanced directive living will is full code. The only patients that aren't full code is the patients that are DNR. So we kind of get that. Who do we resuscitate, who do we not? That we only don't resuscitate the patients who aren't. The DNR is signed by the patient and patient or the surrogate. If the patient is lack of capacity, the surrogate who's named on the living will, the advance directive, can speak for them and signed by the physician. The patient, to have a DNR, in most states, they need to be terminal, end-stage, or persistent vegetative state, or brain dead. Not in Florida. I can be a healthy person in Florida and go to my doctor and go, I don't ever want to be resuscitated. I know I'm healthy now, I don't have any disease. I don't want to be resuscitated. Okay, sign here. Most states require that there be a disease to cause them to be terminal, end-stage, persistent before a DNR comes. I don't know, what is yours? You know? Do you have to have a terminal, end-stage, or persistent vegetative to get a DNR in this state? No. A DNR is not automatic on poor prognosis. Let's say in my living will, it states very clearly, if Larry is terminal, end-stage, persistent vegetative state, or brain dead, then take him off life support. Well, what if I've signed my living will and I have it documented, and also one day my doctor comes to me and goes, Larry, you're terminal. Does that mean at that moment it becomes a do not resuscitate order? Not necessarily. It's another discussion. Is this the time? You may meet the classification for that, but are you ready for that? A whole new, is this proper timing? The living will does not take effect just because you're a terminal, end-stage, or persistent vegetative state. These points right here are very important to catch. The living will, how that's different than the DNR. The living will says, resuscitate me. Now see, we have Grandpa coming into the ER, and Grandpa has a living will, and the family saying, why did they resuscitate Grandpa? He has a living will. Everybody knows he's terminal. Everybody knows he's end stage. Why did they resuscitate him? Because he doesn't have a DNR. We're not there yet. Oh, I thought if I had a living will and it... Well, let's read the living will. If ever I'm on life support and I have a terminal, end-stage, persistent vegetative state, and two physicians agree that I cannot improve, then you go, oh, I guess we aren't there yet, okay? You haven't met that window, because the physician may go, well, I'm not ready to give up. I've got a lot of little tricks in my bag. I'm a cardiologist, we can do something. I'm a pulmonologist, I can do something. I'm a nephrologist, I can help the kidneys. I've got all kind of things. Whoa, whoa, slow down. We're not ready for that. And if the patient goes, okay, let's do a little more, then we aren't ready for that at that moment. So you evaluate the process, keep them on life support if improving, take them off life support if there's a poor prognosis and they're all ready, if two physicians are in agreement. But a do not resuscitate order says, treat me. Do what I want about my illness, going to the doctor, going to the ER, going to the cath lab, going to open heart surgery, doing whatever, but do not put me on life support. Now for patients in your hospital, if you have a do not resuscitate order and it's time to go to surgery, is there a new form to talk about that again, since you might be on life support in a procedure, that if something happens to the procedure, do they discuss it again?
Usually in here, the anesthesiologist normally approaches that.
They approach it again. Our nurses actually have a form they have to bring up at that time for a DNR patient on every procedure. Okay.
It was actually part of the anesthesiologist form. Right.
Okay, they discuss it. Questions and comments about this? This gets so confused sometimes, just about the difference between the living will and the DNR. Anything? All right, let's move along. There are sometimes a DNR that is kind of I call it a quasi DNR. It's not really a DNR. It's maybe a DNI, do not intubate. They're saying do the paddles, do the cardiac drugs, open the cart, but don't intubate me. Like I've been intubated before and I hated that tube down my throat, and don't ever do that, but do all the rest. And you're going, well, how am I going to breathe for you? I'm not going to sit there with a bag and just bag that thing all day. You know, we have to intubate. So it's kind of an education. The package. We need to do this, this, and this to save your life. But some hospitals still allow that. We don't in our hospital anymore. We're like, get out of quasi-codes. Yes?
We have some of those, and it is even more complicated than what you just said, because they want on the drugs and don't do anything. And you go, okay, we